Awesome. So if you could say your first and last name, what program you're in, and what year you're in the program.
So I'm Allison Killen, and I am in the graduate clinical psychology program, and I'm in my second year.
Great. So could you tell me a little bit about the role of a clinical psychologist? What do they do? What do you help to do with your degree with it?
Yeah, so there's a lot of different tracks that you can go in when you're a clinical psychologist, but what I hope to do is mainly therapy, and specifically I would like to work in an integrative care setting, ideally a hospital, doing therapy alongside of other medical professionals. My main goal is to one day work at a children's hospital as part of a palliative care team.
That's great. So you mentioned integrating care and different roles together. Being in the clinic, working with other disciplines, is that helping you at all in your career path and getting prepared?
Oh, yes. It definitely helps a lot to be part of an integrative care team. When I'm working...
When you said
Yeah. Just... You can start up, sorry.
Okay,
so
yeah.
Working in interdisciplinary professional care at the clinic, how is that helpful for your career and preparation?
Yeah, so working as part of an interdisciplinary care team is very helpful, just for the fact that I'm able to get kind of an outside picture that some other disciplines might have, kind of see things from their lens that I might not have thought of, and it really helps us think of the client as a whole person. Like, I focus a lot more on maybe their emotions, how they approach different behaviors, how they might feel about a certain situation, where PT, the physical therapy students, they might focus more on their bodily side of things, and social work focuses more on the resources they have available to them. Occupational therapy can focus more on how they're able to go about all of the activities in their daily life. So bringing all of those focuses together really helps us be able to care for the patient as a whole.
That's great. You really captured it perfectly there. How has your experience in the clinic been?
It's been, yeah, so my experience has been great. It wasn't entirely what I had originally planned for. I thought I might be doing a little bit more individual psychotherapy, but just with the way things have been going in the clinic, we've been doing more on the back side of things, of trying to get things situated, kind of organizing different trainings, talking to physical therapy students, talking to the occupational therapy students and social work students about how we can organize things to bring in more clients, which has been a great benefit, just because even though that wasn't an experience I was looking for, obviously that'll help anywhere, particularly because I want to work in a setting where psychology is not going to be the primary focus. This gives me a lot of experience on how I can get my services out there when people aren't actually looking for those services specifically.
That's fantastic. And so I'm sure you recognize this since being in the clinic, and it's covered at Widener as well, but community engagement and community partnership is really big here. Can you talk a little bit about that, and how that might be affecting your education, your career plan, and that folds into your time in the clinic?
Yeah, so definitely community engagement is really big in the clinical psychology program as well, which is why the program requires us to do a placement every year that we're here. So I really like being at the physical therapy clinic here, just for the fact that they are so closely knit in with the community. Earlier in the fall, we had a meeting with some community members, including some current patients, so they can give their input. And I just think that's so important, because you need that by the feedback from the community to be able to successfully run a clinic like this. Like, they need to be able to buy into what you're doing.
That's great. Do you have any memorable moments of working with clients or being out in the community?
Yeah, so at this site particularly, one of my most memorable moments, I think, is with one client who has a history of chronic hypertension, and that can sometimes interfere with their ability to participate in their physical therapy exercises safely. So even though they have medication that they've been doing, it just wasn't working out. They kept coming in with this chronic hypertension. So I was working with occupational therapy and physical therapy with this client, and through that collaboration, we were able to get their medication adherence more sound, more structured, and also I was able to do a lot of relaxation techniques with this client. And now when this client comes in, I don't even have to go over if their blood pressure is high. They know how to relax on their own. So it's just great being able to see that kind of hold.
That's great. That's wonderful. What attracted you to the clinical psychology program at Widener?
Yeah, so one of the biggest things that attracted me to this program when I was looking was all of the different opportunities that we have in the program. I really appreciate the ability to have a placement out in the community every single year that we're here. Most programs won't allow you to go out into the community your first year. You're more so just stuck in the classroom, and I feel like in order to actually really be able to learn the material, you need to be out there applying it. So I appreciated that a lot. Plus, I knew that this is an area that I wanted to stay in. So with Widener's integrative internship, we're able to stay in the area and do our internship through our 4th and 5th year rather than doing the national match and having to go to California or something. So I really liked both of those aspects. And in the program, even though it's a generalist program, I like that because it means that I can get all of these experience with different therapeutic interventions, different areas of focus. So I'm able to take a lot of health psychology related classes. And also because I'm interested in working with children, I'm able to get my school certificate as well.
That's great. That's awesome. It sounds like you're having a really successful time in the program so far.
Yes.
That's great. Can you talk a little bit about any sort of faculty that you've been able to get to know through your time here? Would there be any faculty mentorship that you've been able to develop here as a student?
Yeah, I think my relationship with Dr. Boyer is probably the biggest that I have here. He is my academic advisor, and he's also the supervisor for this placement. So I definitely spend a significant amount of time with him. And through that, he has shown that he definitely cares about our success here. So even if it's not related to my academics or to this placement, I can go and ask him questions and he'll try to help me out. Like we've talked about different opportunities I could have this summer that relates to psychology, different things like that. So it's been helpful.
That's great. And so this is your second internship or placement, is that
yes,
correct? Where did you do your first placement?
At Delaware Psychiatric Center, which is an inpatient psychiatric hospital.
Great. Did you ever say I did my first placement at? She was running your question.
Okay. Yeah. So I did my first placement at Delaware Psychiatric Center, which is a psychiatric inpatient hospital.
Great. That's wonderful. Do you have a memorable moment? I asked you about the clinic, but you're tied here at Widener or within the program, anything in that realm?
Yeah, so I think just most memorable overall is being able to look back where I was at this point last year and seeing how much I've grown. Part of being in the graduate program is things are going at an extremely fast pace and you're constantly stressed out. You constantly feel like you're overwhelmed learning all of this stuff, but just being able to look back and see how much I've learned in this year and how much I've grown is just really empowering and helps me feel like I'm where I'm meant to be.
That's great. And lastly, why Widener? How has your experience been here? Why did you choose Widener? What has it done for you and help you prepare career-wise?
Yeah, so I chose Widener after doing an internet search and saw that Widener had it has the oldest clinical psychology programs for the PsyD specifically, your doctorate in psychology. And as part of being one of the oldest, they've definitely had time to kind of fine-tune everything in the program. So when I came here for my interview, after meeting with all of the professors, they definitely showed that they had a lot of interest in the students, and they showed all of the different opportunities that we have here, one of which being that you get to be out in the field all 5 years of the program, which not a lot of other places do, and that gives you a lot of opportunity to apply the skills that you're learning. And then the other big thing that drew me in was the integrated internship that they do. So you get to stay in the area and do that internship through your 4th and 5th year, rather than having to do the national match and potentially ending up in like California or someplace across the country. And since I knew I wanted to end up in this area, that worked out really well for me.
Awesome. For anyone who's never heard of the Chester Community Clinic that we're here in Melrose, how would you describe it to them? What do you do? How do they serve people? And who does it serve?
Yes. So it is definitely an interdisciplinary clinic. It's been going through a lot of changes since I've been here.
Sorry, could you start with the Chester Community Clinic?
Yes. Yeah, so the Chester Community Clinic is definitely a very interdisciplinary clinic. It's gone through a lot of changes since I've been here. When I first started, it was known as the Chester Physical Therapy Clinic. And so since that time, they've been making a lot of efforts to integrate a lot more services into the clinic, which is why they felt they needed to change the name as well to kind of match that. So we just try to treat all individuals, regardless of their background, regardless of their medical insurance. If they don't have the ability to pay, they can still come here and just try to work with them on whatever they might be experiencing. If it's an injury, they can meet with the physical therapists for it. If they're having a hard time adjusting to being able to do daily activities of living, they can meet with occupational therapy for that. If maybe there's a lot of life stressors or their injury has really been getting to them emotionally, they can meet with the psychology department about that. Or if they need other resources, which a lot of them do, they can meet with social work. So we've really become all about treating the client with whatever needs that they might have.
That's great. Is there anything else in your educational career or your time in the program or here in the clinic that I didn't touch on that you'd like to talk about?
Just for the graduate psychology program in general, I also really appreciate that you get diverse practicum experiences as well. So as I mentioned, I was at an inpatient unit last year working with adults. This year I'm doing outpatient. Next year I'll be in a school setting working with children. So just being able to work in a diverse area with all types of people from the community is great.
That's great. Awesome. Anything you can think of?
So we're trying to, how about, would you tell other students to think about coming here and why?
Yeah, so I would definitely tell other students to think about coming here just because of all of the opportunities that they have available. You're able to pursue pretty much whatever path you might be interested in. And as part of being a generalist program, if you don't know what you want to do coming in, that's okay. You have opportunity to figure that out. A lot of people think when you're applying to graduate school, you need to know exactly what you want to do afterwards, and that's not necessarily true here at Widener. So that's definitely something that I would encourage people to look at Widener for.
And so your number one reason for coming here was the hands-on experience?
Yes.
Do you think we have enough? I mean, how about just say something like that, just see how nice
Yeah.
short soundbite, not just that.
Yeah, so something about, experiential learning, hands-on experience. Has Widener provided that to you? And if so, how has that helped you in your career so far?
Yes, Widener has definitely provided a lot of hands-on learning for me. When you're working in the classroom, learning all these different theories, they make sense, but you don't really know how it's going to play out until you go out into the community. And so having all of that hands-on experience really helps solidify everything that you learned in the classroom and being able to make you more confident and comfortable working with members of the community.
That was great.
That was good.
That was perfect.
Is there anything else we haven't answered that you'd like to tell somebody that may be watching us?
I don't know.
Yeah, I think you covered it all.
Yeah,
Touched
you
on a lot
probably
of
probably can say, no, that's fine.
Good point.
You don't have to do the same.
That's perfect. Thank you. Yeah.